Terri Harper here at Spa Medical in Macon, Georgia, and I'm going to talk a little bit today about how I approach and evaluate a patient over the age of 40. So there are two things that we do here at Spa Medical. One is we enhance natural features, and usually that's on women a little bit younger. That would be like lips and cheeks. The other thing that we do is we restore or rejuvenate natural features and create some things that we've lost in the patient, generally over the age of 40. What I like to do is start by asking the patient, what bothers you the most? And that's our starting place. Even though I know just by virtue of getting older, the facial shape changes. And so what we're looking at is usually the same thing that bothers them the most, which is going to need changing the shape of the face. So we start out with an inverted triangular shape. It morphs into a rectangular shape, and then the dreaded triangular shape where we have more volume here. So as we seek to restore the natural, beautiful shape of the face, we generally are talking about restoring the volume and support structure up in the upper face. So we're going to take a look at a couple of patients and see what they need. So I'm here with Anna, who's in her early 40s, and I'm going to first give her a mirror and let her show us exactly the areas that are beginning to bother her when she looks in the mirror every morning.
So Terri, it looks like when I look in the mirror every morning, I'm concerned about this area right here. It seems to have had some volume loss, I guess, right there. And also I'm very concerned about everything seems to be moving down, especially here in this area. Do you know what I mean?
Yeah, I hear that a lot. I really do. And we're going to show you guys a chart of volume loss that I'm going to show Anna. And this, no matter what we do, this is what happens chronologically as we age. And one of the big things that Anna mentioned is her volume loss right through here. And when you lose the structure here, then the skin has nothing to support it, and it wants to sag down. So with this particular issue, one thing we would do is come here with a little filler and recreate, again, not just enhance, but recreate the volume that used to be here with a dermal filler. The other thing here we will do, and one of our latest, newest procedures that we're really loving, is to create a more defined jawline. So if you think the volume is getting lost here, the skin begins to sag, and so it begins to sag all the way down here. So Anna has beautiful features, and we would just come in and define a little bit of the jawline and recreate the cheek area right here. And let me just say, on all women, I don't care how old you are, Botox is your friend. So you've heard me say it before, Botox is like the peanut butter and jelly of anti-aging. It's a staple you need to keep in your cupboard, because you're going to get not only short-term benefit, but long-term benefit from the effects that Botox has on your skin and on your general appearance. So with Botox, I can manipulate muscle movement, I can lift things, I can relax things, and I can smooth things with Botox. So every age group is going to benefit from Botox. Anna is a perfect example of Botox and a little rejuvenation of some volume loss in the cheek and jaw area. Okay, so we're here with Kim now. She's in her 60s and may have a little different set of issues than Anna in her early 40s. So Kim, look in the mirror and tell us what bothers you the most.
Okay, around the mouth, the fine lines, of course, and then this feels like it's a little flat. Up under my eyes, and then the fine lines here.
Okay, yeah. So that is so typical of women in their 50s and 60s. They come in, the majority of women are going to say right around here, this bothers me. And let me give you a little hint why that happens. So we know as we age down, but on our faces, we age down and in. and down and in. So this area and this area gets the brunt of aging. And this is a very, very typical concern that women in their 50s and 60s would have. So there are several things that we can do about this area around here. One of the things is dermal filler, that we're gonna create a support structure for this. So I tell my patients this area, it almost shrivels and sinks back a little bit. So we're going to create structure to keep that from happening. And the filler, believe it or not, actually goes this way and this way to create a scaffolding of support around the perioral or around the mouth area. Also, this is a circular muscle, and every time that muscle contracts, it acts like a purse string pulling together to create a pucker. So what we're going to do is slightly relax that with the drug that relaxes muscles, which is Botox. And one other modality we use for this area is the microneedling with radio frequency. Our device is called the Secret RF. So it creates tiny channels within the skin around here and delivers the radio frequency energy, which tightens the skin. Between the channels that regrow collagen and the tightening of the skin, we've seen some excellent results in this area as well. So the second area Kim mentioned was maybe under the eye area. This, as we refer back to our chart of volume loss, this is an area that we do lose volume, and there's nothing for the skin to be supported by. So there are a couple things we can do with this. We can come right through the depression, or what is called the tear trough. We can come right through here and add a little bit of volume, and we could add volume in the entire mid-face, starting over here and here to lift this back up. As we lift this part of the skin back up, we relieve a little bit of the nasolabial fold, as well as we relieve a little bit of the depression here. Again, the Secret RF, microneedling with radiofrequency, is another great modality to treat this area as well. The other thing I think Kim mentioned was a little feeling like her face. I've heard it all, feeling like your face is falling off, melting off, sagging, these things, right through here. Again, we're mainly talking about relaxation of the skin as well as lack of support structure. So when we create support structure here, it lifts this. Kim was also a great candidate for filler along here to redefine the jawline and create some support structure there. So I'm excited about working with these two age groups of patients and restoring some volume loss and refreshing their general appearance. If you fall in one of these categories, I would love to talk with you to find out your aesthetic goals and see what we can do to help you.